a global public health concern. WHO has already declared it as an emergency. The purpose of this webinar is to brush up our knowledge related to infection control and prevention with regard to management of COVID-19 patients. Today I am proposing to follow this outline. We'll be talking about coronavirus, the risk of COVID-19 among healthcare professionals, transmission of COVID-19 among healthcare personnel, protecting healthcare professionals from COVID-19 using standard precautions, respiratory and contact precautions. In case of accidental exposure, what is to be done by the healthcare professional, patient assessment and placement, and how to ensure that patient is isolated and barrier nursing is provided. In case if healthcare professional has a contact with the positive patient, then whom to contact for the services. And finally, I'll conclude with some take-home message. To start with, coronavirus belongs to a family of viruses that causes illness ranging from common cold to more severe diseases. A novel coronavirus, it's a new strain that has not been previously identified in human beings. There has been human-to-human transmission. Now the question arises, are healthcare professionals at risk? Yes, healthcare professionals can be at risk. They can be at risk of acquiring the infection through respiratory route and direct contact with infectious patients. How does COVID-19 spread? It is from human to human, from person to person via respiratory droplet infection. That is the primary mode of transmission, followed by close contact. And this close contact can occur while caring for a patient, including being within approximately 6 feet, that is 2 meters of a patient within COVID-19 for a prolonged period of time, having direct contact with infectious secretions such as sputum, serum, blood, and respiratory droplets of a patient with COVID-19. If close contact occurs while not wearing all the recommended personal protective equipment. Again, a very big question is there in front of us: how to protect ourselves as healthcare professionals. How can we protect ourselves from COVID-19? We have to follow the standard recommendations, which includes standard precautions, respiratory precautions, and contact precautions, so as to prevent infection spread from patients to the healthcare personnel. Let's see what the standard precautions are. We all are familiar with the standard precautions. These are the set of interventions carried out by healthcare professionals while taking care of infected patient. Healthcare workers caring for patients under investigations or confirmed cases should implement standard infection control precautions, which include observing basic hygiene, use of personal protective equipment, respiratory etiquettes, maintaining environmental cleaning and disinfection, biomedical waste management, and finally, safe handling of dead bodies. So let us see one by one. So we start with hand hygiene. We all know that hand hygiene is one of the most simplest and cost-effective method of controlling the spread of infection. Hand hygiene can be performed using soap and water or alcohol-based hand rub. We should perform hand hygiene with alcohol-based hand rub or soap and water before and after all patients' contact with potentially infectious material, and before putting on and upon removal of personal protective equipment, including gloves. Remember, whenever our hands are visibly soiled, we need to wash with soap and water, not with the alcohol rub. So hand hygiene should be performed immediately after contact with the respiratory secretions and as and when you feel that you have touched the patient or the patient's belongings, which act as fomites. The second important component of standard precautions is referring to the use of personal protective equipment. Healthcare workers, they are involved in direct patient care. They should make use of the following PPE. That is, the gowns, gloves, medical mask, eye protection, including goggles or face shield. Selection of personal protective equipment should be done very carefully, considering the nature of activities we are involved in. For example, we are performing aerosolized procedures where the aerosols are likely to get generated. For example, endotracheal suctioning, while giving bag and mask ventilation, while providing non-invasive ventilation, or during bronchoscopy when we are assisting. As nurses, when we are assisting for bronchoscopic procedures, there we have to make use of the personal protective equipment, and then we have to also perform hand hygiene before putting on and after taking off PPE. Discard PPE in appropriate waste container after use. So use of personal protective equipment is decided depending upon whether you are involved in direct patient care or you are there as an ancillary staff, what type of procedure you are doing, which type of setting you are working in. For example, if you are working in the emergency department, ICU or ward, there you have to make use of particulate respirator like N95. While in screening areas or in the OPD, one can still manage with the 3-layer surgical mask. There are number of steps involved while donning and doffing the personal protective equipment. So there are 9 steps involved in wearing the personal protective equipment, while 19 steps are involved in removal of personal protective equipment. So one has to be very, very careful while donning as well as doffing the PPE. In between, hand hygiene is recommended between the 2 steps, like when you are removing your mask and between removal of goggles or gowns or gloves, it is recommended to maintain the hand hygiene. Use of double gloves is recommended when you are in contact with COVID-19 patients. Then there are transmission-based precautions to be observed. They are mainly of 2 types: respiratory precautions and contact precautions. Respiratory precautions, let us discuss in detail how we can ensure the respiratory precautions. Wear a medical mask while entering a room where the patient suspected or confirmed of being infected with Corona-19 are admitted. Use a particulate respirator like N95, gloves and gowns, aprons when performing aerosolized generating procedures such as tracheal intubation, non-invasive ventilation, tracheostomy, cardiopulmonary resuscitation, manual ventilation before intubation, and while assisting for bronchoscopy. Environmental cleaning and disinfection is considered to be an integral part of the standard precautions. We have to emphasize on routine cleaning and disinfection procedures as appropriate in the healthcare settings. Only the intensity and frequency is to be increased. In the areas like laundry, food services, we have to manage the laundry, food services and utensil in accordance with routine procedures. In environmental cleaning, the person whosoever is involved in the process of environment cleaning should ensure that personal protective equipments are on. Cleaning agents and disinfectants like 1% sodium hypochlorite solution can be prepared. Usually we have 5% sodium hypochlorite solution available. This can be reduced to the strength of 1% by diluting 200 ml of sodium hypochlorite with 800 ml of water. The solution should be prepared fresh. if you are using a long-standing solution, it is likely to lose its potency. So ensure that the solution which is prepared for the cleaning purpose is freshly prepared and it should be covered. Otherwise, there would be escape of chlorine gas and therefore making the sodium hypochlorite solution ineffective. Leave the solution for a contact time of at least 10 minutes. There are certain surfaces where the use of bleaching powder or the bleaching agent is not recommended, such as metals. So in those surface areas, alcohol, that is either isopropyl alcohol 70% or ethyl alcohol 70% can be used to wipe down the surfaces. There are some cleaning guidelines. First of all, we have to ensure that the area where the cleaning is going to take place is sealed off. So seal off the areas where the confirmed case has visited before carrying out cleaning and disinfection. Mopping the floor with routinely available deodorizing agents like phenyl or 1% hypochlorite disinfectant solution can be used. Wipe down all accessible surfaces of wall as well as the blinds with bleach solution. Discard cleaning items into biohazard bags. Disinfect buckets. The buckets which were used for the cleaning purpose should be disinfected by soaking in 1% hypochlorite or bleach solution. Dispose of the waste generated as a result of cleaning into biohazard bags. Cleaning staff should be attired in suitable personal protective equipment. This is something very, very essential and mandatory. Regarding decontamination and biomedical waste management, disinfect any surface or material known to be or potentially be contaminated. We have to identify and segregate contaminated material before decontamination and or disposal as biomedical waste guidelines. Where contamination has occurred but the process of decontamination is not possible, like the laboratory, we need to package the contaminated waste for transfer to another facility with decontamination capacity. So while decontaminating the equipments and the waste and the biomedical waste generated as a result of patient care, one has to ensure that heavy duty gloves are put on along with disposable long sleeve gown, eye goggles or a face shield and a medical mask. Now coming to contact precautions. The contact transmission between an infected or colonized person and a susceptible host can be through direct contact. Either it is body to body surface or it can be indirect through fomites. So all the patient's belongings, the patient care items present in the patient care unit, they can act as fomites. Contact precautions can be observed by ensuring frequent hand hygiene, making use of personal protective equipments, and decontaminating the items more frequently. Here I would like to say that there are two types of surfaces available: low touch areas and the high touch areas. High touch areas are required to be cleaned more frequently. Again, we have clinical areas and non-clinical areas. So in clinical areas, maybe every 1 to 2 hourly, the high touch areas like the door handle, the switches, buttons, knobs of the monitor, they can be cleaned more frequently, like 1 to 2 hours. While in non-clinical areas like the laboratory, the frequency of cleaning can be every 3 to 4 hours. Finally, handling the dead bodies. When handling of dead bodies is concerned, we have to avoid direct contact with blood or body fluids from the dead body. put on personal protective equipment. Make sure that if healthcare professional has any wounds, cuts or abrasions, they are covered with waterproof bandage or dressings. We are not supposed to be eating, drinking or smoking near the dead body. Do not touch your eyes, mouth or nose. Observe strict personal and hand hygiene. Avoid sharp injuries which can occur during the course of examination of dead body and decontamination. Remove personal protective equipment after handling of the dead body. Wash hands with liquid soap and water immediately. In case of accidental exposure to blood and body fluids, for example, it's a percutaneous injury or a mucocutaneous exposure, one has to wash the site thoroughly with soap and water. For example, if the splash is in the eye, then we need to wash the site with copious amount of water. If it is percutaneous type of injury, there we need to thoroughly wash it with soap and water. All such incidents of percutaneous or mucocutaneous exposures are to be reported and we have to immediately seek the medical advice. When we have a patient coming to us in the triage area or in the ward or ICU, how we are going to assess a patient for COVID-19. First of all, we have to take history and identify if in the past 14 days since the first onset of symptoms, a history of either travel to epidemic area or close contact with a person known to have COVID-19 illness, and the person has fever or symptoms of lower respiratory illness such as cough, shortness of breath. Along with this, person can have cough, dryness of oral cavity leading to progressive cough, fatigue, malaise, and later on some kind of GI symptoms such as vomiting and diarrhea can also be noticed. So if both exposure and illness are present and confirmed by the laboratory test, we need to isolate the patient. These patients should have the face mask on them. Isolate the patient in a private or a separate room. Wear appropriate personal protective equipment while providing care to these patients. Continue to assess their clinical status and provide appropriate treatment. Assess and triage patients with acute respiratory symptoms and risk factors for COVID-19 so as to minimize the chances of exposure. So the patients who are reporting with acute respiratory symptoms or some risk factors, they are to be immediately triaged and they should be placed in an isolated area. Make them put on the face mask and place them in the examination room with the closed door in an airborne infection isolation room if available. Now we move on to the nursing care. While providing nursing care to these patients, we have to observe barrier nursing. Barrier nursing is a special kind of nursing provided to the patient so as to protect the healthcare professionals from acquiring the infection with which patient has got admitted and further preventing the spread of infection from one person to another person. The patient under investigation or a confirmed case has to be admitted in an isolation room with negative pressure and at least 6 to 10 air exchanges should take place per hour. Only the essential personnel should enter the room. We need to restrict the entry of all the healthcare professionals present in the ward or ICU. Only few dedicated personnel should be allowed to enter the room. Make use of dedicated or disposable non-critical patient care equipment such as thermometers, blood pressure cuffs, saturation monitoring probes, etc. If the equipment is to be used for more than one patient, clean and disinfect such equipment before use on another patient according to the manufacturer's instructions. Healthcare personnel, while entering the room or soon after, a person or a patient when vacates the room should continue to use respiratory protection. So the healthcare personnel entering the room soon after a patient vacates the room should use respiratory protection. Few words about the safety of healthcare professionals. Many times it can happen the personal protective equipment loses its integrity, it's torn, or it is not properly used by the healthcare professionals. In such situation, we have to seek the medical help. When to contact the occupational health services? We have to contact the occupational health services in case of unprotected exposure, that is, not wearing or inappropriately using the recommended PPE. To a confirmed or a possible COVID-19 patient, contact supervisor or occupational health services immediately. So whenever there is a history of unprotected exposure by any healthcare personnel, the person has to contact the supervisor or the occupational health services immediately. If one develops symptoms consistent with COVID-19 such as fever, cough, or difficulty in breathing, don't report to work and should contact the occupational health services. So finally, there is a take-home message for the healthcare professionals. The nurses and the doctors, they are the frontline soldiers to fight a battle against COVID-19. We have to ensure that the protective measures are used. Take protective measures in workplace, learn properly how to use the PPE, donning of PPE as well as doffing of PPE is essential so as to protect oneself from getting sick. Encourage all the members of healthcare team to take protective measures. This is a time to remain calm and composed and encourage all the healthcare team members to observe the personal protective measures, the safety measures, the standard measures, universal precautions, and transmission-based precautions. So with this, I conclude this webinar. This is the list of references